So let's talk about scabies. As you have come across most commonly an OPD setup with this disease, and inshallah after watching this video you have a complete outline of scabies. So what is scabies? It is itchy, contagious, ectoparasite skin infestation. So in scabies there is itchy papule. So oftenly you will see that there is itchy papule. Papule means raised lesion having diameter less than 10 mm. I already make a detailed video on basic skin lesion, so make sure to watch that video as well. So in scabies there is itchy papule. There is it is contagious condition, meaning the disease is readily transmitted from person to person, and it is ectoparasitic skin infestation. So what is the most causative agent of the scabies? So that is itch mite. Itch mite, it is the most common cause of the scabies, and itch mite, that is sarceptos scabies, sarceptos scabies var hominis. So it is the main cause of scabies, that is sarceptos scabies var hominis. Scabies is also known as water wash disease. It is also known as water wash disease. So the patient who are suffering from the scabies, they usually can't maintain the personal hygiene condition. So sarceptos scabies, they get stuck into the bodies of such patients. So it is so important that the second name of the scabies is water wash disease. So what is the history of the patient? The patient who are suffering from the scabies, they are usually give you a typical history that I couldn't able to sleep properly at night time. And why it is so? Because of intense pruritus, because of intense itching. So these patients will come to you with the main complaint of the, yes, nocturnal pruritus. Nocturnal pruritus, intense itching during night. Also, the family history is important. Family history is very important in such condition, because as we discussed earlier, it is contagious disease. So this disease is readily transmitted from one person to another person. So in the history, the nocturnal pruritus and family history is so important. Secondly, what are the clinical features of these patient? So in this patient, there is excoriated papule. There will be excoriated papule. What does it mean? Means there will be raised lesion and diameter less than 10 mm. Also, the most specific feature for the scabies, that is Barrow's lesion. So what is Barrow lesion? Barrow lesion, basically it is a serpiginous branching tunnel lesion in skin. So what does Barrow lesion means? In case of scabies, there is serpiginous branching tunnel lesion in the skin. What does it mean? It means, as you know that, let's say if this is epidermis, okay, if this is epidermis and this is dermis. So in epidermis, we know that there are 5 layers. In epidermis, there are 5 layers. The most superficial layer in epidermis, that is known as stratum corneum. The next is stratum lucidum, stratum granulosum, and stratum spinosum, and then stratum basalis, as we know that. So what happens, that the sarceptos scabies, it incorporated, let's say if this is sarceptos scabies, so this sarceptos scabies, it incorporated in the stratum corneum, and the stratum corneum of epidermis of the skin. When it comes into the stratum corneum, so what happens, that there will be branching pattern like lesion, like a snake-like lesion formed by these Scabies, and these lesions are known as barrow lesions. Barrow lesions are so called as serpiginous lesion because they look like a snake. So in case of scabies, when you see the lesion will typically give you appearance of a serpiginous or a barrow lesion. Once the scabies, when it reach to the carnium, so it may lay eggs. So after 24 hours, or even in some literature it mentioned after 2 months, this might it get dies. So eggs hatch and larva mature to become an adult female Scabies. So again there will be type 4 hypersensitivity. So this is how actually the Scabies it form the lesion. Now, what is the site of lesion? Mostly in scabies, the most common site is interdigital spaces. So the most common site is, yes, that is interdigital spaces, meaning in between fingers and toes. So it is the most common site for the scabies lesion. Let's talk about the circle of Hebra. In circle of Hebra, first, the lesion appear in interdigital spaces. Then, from interdigital spaces, the lesion appear in medial aspect of arm and forearms. Then axilla. Then periareolar area in the nipple. Then umbilicus. Then genitals, and then groin area. Now, this pattern of appearance of lesion scabies, the pattern is known as circle of Hebra. Okay, so interdigital spaces, middle aspect of arms and forearms, axilla, nipple, umbilicus, genitals, and groin area. That in scabies, usually the adult patient, the face is speared. In adults, the face is speared, but in infants, face is involved. Let's discuss the types of scabies. So the first type is that is known as infantile scabies. So infantile scabies, it is self-explanatory term. It is most commonly in infants, and usually it involves the palms and soles, and it also involve the face. Usually in infantile scabies, there is specific pattern of lesion that is vesicle. So vesicle is nothing but it is the raised lesion having fluid and having diameter less than 10 mm. So please make sure to watch the basic skin lesion video so that you can easily pick up the certain terminologies. So whenever we give the permethrin lotion, usually permethrin lotion it is applied below the neck area, but in infantile scabies as the face involvement are there, so whenever you give permethrin lotion, that permethrin lotion should be applied on face as well. So it is important. Secondly, there is another type of scabies. This is known as Norwegian scabies. Norwegian scabies is also known as crusted scabies. Okay, so it is the most severe form of scabies. It is the most severe form of scabies. Usually, it is most common in immunocompromised patients. So, Norwegian scabies or crusted scabies, it is most severe form of scabies. It is present in immunocompromised patient. In Norwegian scabies, there is hyperkeratotic crusted lesion are there. What does it mean? It means there will be hyperkeratosis are there. Hyperkeratosis means increased thickening of the skin. So when you see the lesion in case of Norwegian scabies, there will be hyperkeratotic crusted lesion. The most important point regarding crusted scabies is that whenever you come across with these patients, there will be minimum itching or no itching. So these patients they have a minimal or no itching. Why it is so? The reason is encrusted scabies it involves the nerves. So nerves get damaged and because of neuropathy there will be decreased sensation. So that's the main important point. So this is Norwegian scabies. And whenever we want to treat such patient, first it is important that we should treat the hyperkeratotic skin. First we should decrease the hyperkeratosis. Mean we have to give keratolytic agents in the form of salicylic acid so that the skin become thin, and after that we can give ivermectins, etc. So it's important. Thirdly, there is another type that is known as nodular scabies. Nodular scabies, it is most commonly involve the folds. The nodules appear in axilla and scrotum. I repeat, there are three types of scabies: infantile scabies, Norwegian scabies, nodular scabies. Infantile scabies are most commonly involving the palm, soles, and face, and usually the lesion is vesicles are there. Norwegian scabies, it is most severe form. There is hyperkeratotic crusted lesion. There will be no itching. But in case of nodular scabies, it involves the folds area like axilla and scrotum. Talk about the investigations. So usually the diagnosis is made by clinical. So clinical diagnosis is important. Mostly it is diagnosed clinically, but also we can do dermoscopy. Dermoscopy for mite. In dermoscopy we will look upon the mite. Also we can do the microscopic examination of skin by using adhesive tapes. Also, we can go for skin scraping and histology. But this is very rare. We can't do such in case of scabies. Also, we can go for potassium hydroxide mount. And potassium hydroxide mount, it is used for mite eggs. Let's talk about the treatment option. So the drug of choice in case of scabies, that is 5% permethrin lotion. So 5% permethrin lotion, it is the drug of choice. What is the mechanism of 5% permethrin lotion? Actually, it blocks the voltage gated sodium channel and cause the paralysis of scabies. So that is the main action of permethrin lotion. Now, how we will apply the permethrin lotion? Well, the application of permethrin lotion. So the half bottle of permethrin lotion, it is applied below the neck area for 24 hours and then taken bath and wait for a week, and after 1 week applied apply the rest of bottle below neck area. So this is how you will apply the permethrin lotion. Permethrin half bottle will apply the below the neck area, most preferably in the circle of Hebra pattern where the lesion more pronounced and interdigital spaces, the medial aspect of upper arm, forearm, axilla, nipple, umbilical region and groin region. So most preferably it is applied for 24 hours and then take a bath and wait for 1 week. After 1 week, the remaining bottle should be applied in the same fashion. So this is how you will apply the permethrin lotion. But by any means, if 5% permethrin is not available, then you can go for alternatives as well. So the alternatives are, if 5%, usually most commonly we apply 5% permethrin lotion. If it is not available, then we can use 1% linden. 1% linden consists of gamma benzene dihydrochloride. Okay, so 1% linden consists of gamma benzene dihydrochloride. But the most important point regarding 1% linden is that 1% linden, it is contraindicated in less than 10 years of age patient, in pregnancy and lactational period. So always keep in mind that 1% linden should not be given in less than 10 years of patients, pregnancy and lactational period. Why it is so? As it can precipitate the seizure condition. Second option is oral ivermectins. Oral ivermectins. So the oral ivermectins, it is given in case of severe scabies, and the dose is 200 microgram per kg. So oral ivermectin can be given in severe scabies condition, and the dose is 200 microgram per kg. So the another option is crotamine 10% cream or lotion is also available. For ointment, sulfur ointment can be given, but it is not as much effective. So as we know that the itching is main complaint in case of scabies. So for the symptomatic relief, you can give antihistamine as well. The general Meyer care is important. Patient should wash all textiles and should bath regularly. So that's all about the scabies. So I hope you liked the video, and thank you so much.